evening. A doctor's surgery serving 10,000 patients in one of the most deprived parts of Nottingham says it may have to close because of a tenfold increase in service charges.
The Wellspring practice, which is based at the Valley Centre in St Anne's, opened in 2012. And now the managers say they simply can't afford the increase in costs, which could result in the surgery closing for good. Nancy Cole explains.
There's counting out here in the waiting room, and behind the scenes, bosses at the Wellspring surgery in the St Anne's area of Nottingham are struggling to make the figures add up. GPs say the rising cost of service charges, so not the rates or the rent for the building, but the cost of general maintenance, is leaving partners at risk of bankruptcy. They say they've gone up tenfold from the £25,000 a year they first paid when they moved in 5 years ago, with no explanation why.
This financial year is £265,000. We're disputing the previous years as well. The total bill is somewhere about £460,000, £500,000. You know, we do not have that kind of money to pay, and simply put, we would be bankrupt if we paid that money. We wouldn't have the money to pay the staff. We wouldn't be able to retain the staff if we paid it. And then obviously that means that we can't keep the practice running.
The surgery, which operates inside the St Anne's Valley Centre, is owned by Nottingham City Council, who say it's a matter between the surgery and NHS Property Services, which sublease the use of the site to the surgery. It's told us its costs and charges haven't changed significantly, and believe the surgery's bills could have increased because of lost subsidies. Nottingham City CCG, which commissions GP services, has requested an urgent meeting to discuss the basis of the charges. GPs fear if they can't pay the bill, it could see them forced to close.
If this practice was to shut, I don't know what it means, simply put, but it means that there won't be a healthcare service provision at that time. Those patients would either have to be dispersed to the local practices nearby, which are already at breaking point, as many practices are across the country, and those practices themselves have told us they could not manage an influx of patients like that.
There's a dispute with how much it's costing the landlords, and obviously that isn't really something that patients should be concerned about, but they're worried about it. So I think it's time to knock some heads together, get all of the different agencies, because it's all part of the public sector, to sit down, work this out, and let's put patients' minds at rest, make sure that we keep this very valued and much loved GP practice.
Stuck to every available wall space in the surgery, a notice to patients warning them the service is at risk. For this community, for which 10,000 residents depend on the doctors here, it's devastating news.
It's really the elderly people, really, because they can't get around. It's them that I feel sorry for. They can't walk all the way up to Colston Road or Mary Potter. It's mainly them, really, I feel sorry for.
I would appeal to the people of my community to rise up and to do something about this atrocity.